all. Thanks so much for joining us on Speaking of Making Healthcare Work for You. I'm Stephanie Fields, joined by my co-host, Dr. Apurv Gupta, and today we are talking about our interview with Peter Hayes, who is the CEO and president of the Healthcare Purchaser Alliance of Maine. And I love this conversation. He is doing so many innovative things through this alliance to reduce the healthcare costs and to expose what the disparities are between what hospitals are charging, what drug costs are. He talked about everything from the number of people, which is 60% of type 2 diabetics could actually get off of their medication potentially, and obviously reduce their cost through that just by modifying diet and exercise. And he talked about the cost of knee replacements being anywhere from a couple $1,000s, $10,000 to hundreds of thousands of dollars. And the vast difference in cost and quality from different hospitals, and how important it is for purchasers to really check into that and to be educated when you're making those decisions, because it does make a big impact on both your clinical outcome, but also your financial situation. Apurv, what stood out to you?
Stephanie, thank you. I think it was a fascinating conversation also. He's such a knowledgeable individual. Clearly, you can see his passion, and it's so personal. I mean, he shared the story of his son and how he nearly had to make a decision to terminate life support, which thankfully he didn't because his son made it through that illness and he got through. And ultimately, that's the kind of thing that powers, leaders like Peter, because they remember that mistakes can happen in hospitals. And unfortunately, sometimes you don't get all the information that you need. So it was a good, call to arms for all of us to think about when we're in situations like that, to make sure we keep our wits about us. We think about what's going on. We try to get maybe an advocate, someone who's not so emotionally attached to the situation, to be present, to be helping us think through the situation. I loved his recommendations about second opinions. That's personally one of my favorites. Whenever one of my friends comes to me for any healthcare issues, it's usually my go-to charm, which is, especially if it's anything complicated, have you really gone and sought a second opinion, sometimes a third opinion, because people differ in how they evaluate situations. And I think it's very important when we as consumers are making decisions that are particularly fraught with all these life challenging sort of issues, that we're thinking carefully about how we make those decisions. So I love his passion. I love the range of what he's trying to work on in terms of quality, safety, patient experience, price transparency. And I really like ultimately the simple message, which is what we've heard, Stephanie, so many times from many of our guests. It comes back to each of us as individuals and us being advocates for ourselves.
Absolutely. And I definitely echo your thoughts on getting a second opinion. In fact, you and I were just talking yesterday about something that there were a couple different opinions on a doctor on my end. And I wanted to know what yours was, because I do think it's important to consider those and it can make a difference. So stay tuned for the
So
conversation with Peter, and be sure to keep tuning into all of the other content to hear our really great conversations with these leaders who are making a difference. Thanks for watching.
excellent.
I'll talk to you soon. Bye bye.
Thank you. Bye bye.